Good day, I'm Stephen McHugh, and this is your JIS News for Wednesday, October 13. The COVID allocation of resources for employees CARE program has been increased by an additional $5.3 billion. The allocation is included in the first supplementary estimates and will be administered under the Serve Jamaica program to provide further support to the vulnerable population. Finance Minister Dr. Nigel Clark gave the breakdown in Parliament yesterday. It includes an automatic one-off payment of $10,000 to all heads of PATH households and NIS pensioners receiving $10,000 or less per month.
It's automatic, there's no need to apply. It will be implemented by the Ministry of Labour and Social Security, Minister Samuda, in coordination with the Ministry of Finance and the Public Service.
$1.3 billion will provide a one-off grant of $10,000 to employees on the PAYE system who earn a gross salary less than or equal to $15,000 weekly or $60,000 per month. It also includes self-employed persons whose statutory income is less than or equal to $60,000 per month. These persons will need to apply through the We Care program portal. Meanwhile, the Set Cash program will provide a one-off automatic grant of $18,000 to persons already in the Set Cash database and are still unemployed. The support continues with all qualified social pensioners receiving an automatic one-off grant of $10,000, while $100 million will each go to the Poor Relief and Public Assistance departments. The government will also embark on a $1 billion CARE food package drive in partnership with members of Parliament, councillors, NGOs, churches, and the private sector. This will facilitate the distribution of food packages to between 200,000 and 250,000 persons.
At this time in the pandemic where we're seeing the effects, food prices are up, we are going to respond in a massive way. Now, a food drive to the tune that we have not had, certainly that I've not seen in my time.
The Attorney General's chambers will soon be perusing amendments to the Child Care and Protection Act, the Adoption Act, and the Maxfield Park Center of Excellence Cabinet Note. State Minister in the Ministry of Education, Robert Morgan, made the disclosure during Tuesday's State of the Constituency debate in Parliament. He said the new legislations will improve the standard of care in the children's homes.
In consultation with my lead minister, we're formulating a new standard for children's homes in Jamaica, where we have an objective test to determine the quality of care that is being given to children in these places.
Minister Morgan says developments such as a therapeutic center at Maxfield Park Children's Home will be replicated in other facilities across Jamaica. Prime Minister Andrew Holness is calling for unity as the country executes its COVID-19 vaccination program to recover from the coronavirus. Mr. Holness asserts that citizens have a duty to take the available COVID-19 vaccines so that the country can return to normal operations. According to the Prime Minister, it is unfair that those who have been fully vaccinated are not benefiting from being inoculated, as the country's take-up rate is too low to achieve herd immunity.
If it is that we are moving out of a pandemic by taking the vaccines, we should not be making special allocations for COVID care, when there are other illnesses that people have had to be putting off treatment for in order to facilitate COVID care. That can't continue. Why should children who have taken vaccines not be able to go to school? They should be able to go to school.
Prime Minister Holness made the comments as he toured vaccination sites in East Central, South, and Southeastern St. Catherine. The tour forms part of the government's wider COVID-19 vaccination mobilization and communications campaign to increase vaccination numbers. Up to October 12, only 10.9%, or 841,024 Jamaicans, have been vaccinated against COVID-19. More than 125 persons of the homeless population in the corporate area have been vaccinated. The information was revealed by Mayor Delroy Williams during yesterday's monthly sitting of the Kingston and St. Andrew Municipal Corporation, KSAMC. Mayor Williams said 60 individuals were inoculated on World Homeless Day, which was observed on Sunday. Those persons joined 65 other homeless citizens who were vaccinated in August.
On Sunday, the vaccine administered was the Johnson & Johnson, so one shot. So those persons are fully vaccinated. The original 65 persons are scheduled to have their second dose on vaccine on Thursday of this week.
The vaccination exercise, which is ongoing, is organized by the Poor Relief Department in collaboration with the Ministry of Health and Wellness. It is conducted at the Marie Atkins Homeless Shelter in downtown Kingston. And finally, the Mandeville Regional Hospital has received a donation of a urology machine, which will advance the quality of patient care at the facility. The donation will allow patients to receive on-the-spot diagnosis and medical management of their condition. The machine, valued at about $700,000, was gifted by the Rotary Club of Mandeville. And that's it for JIS News Today. I'm Stephen McHugh. Thanks for watching.